I don't think it's any secret that youth suicide as well as overall suicide rates have been steadily increasing over the last several years. And in fact, we have a new article just published in October of 2022 when we're filming this video, which actually points to a 45.2% increase. That's a 45% increase in the past 10 years of suicide deaths. That's completed suicides among adolescents in the United States. The most disproportionate increases occurred among the youths who are members of minority groups. However, we have to be mindful of the overall rates of suicide. So on your screen now, you'll see a graphic that shows suicide rates by age, and this is data courtesy of CDC, and it shows that in your median age groups of 15 to 65 is where the most suicides occur. So we're looking at the highest rate being the ages of 45 to 64 and 75 plus. Now, we're not going to get into the reasons and causalities behind that, but it's important to know the demographics because if you have a youth in front of you who's ideating suicide, that's important to know. On the right side of the screen, you'll see that the male suicide completion rate is much, much higher than the female suicide completion rate. However, the age demographic is highest on both in that 45 to 64 group, except for the 75 plus, which we can debate why that is. But it's important to know because who are your most firearms owning demographics? Males 45 to 64. So we want to be mindful of that. If we're dealing with approximately half of our population who's going to walk through the door of the clinic owning or living with a firearm, and they fall into that category, we have to be able to talk with them competently about what to do in times of crisis and intervention. So let's move on. The next slide you'll see is suicide rates by race. So who are the most likely to complete suicides in a racial breakdown? You see Hispanic at the bottom at 12.1 per 100,000, white 30, black 12, Asian Pacific Islander almost 11, and American Indian, that's Native Americans, almost 35%. So we want to pay attention to race because that matters. We want to pay attention to age, and we want to pay attention to sex because those things matter. And when you stack those all up, you want to know who's more at risk than somebody else who's sitting in front of you. And if we go through, we go, well, who's most likely to die by suicide? Men, Native American men, white men, and everybody between the ages of 45 and 64. And then, of course, 75 plus. That is our gun-owning community. That's the prototypical white male with a gun that you see in everybody's mind. Now, that's also a stereotype that's increasingly untrue, and we'll get more into that in a minute. But also, let's not forget our LGBTQ teens, because we know from some studies also from more recent than UCLA at 2015, which you'll see on your screen, but because about 50% of males and 30% of females and then 41% of trans adults had attempted within the past year. That is an extraordinarily high percentage when you compare it to the average non-LGBTQ population. So we want to be mindful of this, that when we're saying, just do affirming care. Well, maybe affirming care isn't what's required because as we affirm, we're actually pushing people into a higher risk demographic if they transition, if they go on to adulthood. I mean, 41% is very, very high. So we can talk about that another time. There are other presentations that deal with that, but we want to be mindful of this as we're sitting in front of somebody and we don't know how to talk about firearms in the home when they're ideating suicide. Let's move on. So we're still on the who's most likely to die, right? But we have some data from 2020 that indicate that while nationally suicide deaths dropped overall because there was the pandemic and the lockdowns, and there's lots of reasons for why the numbers dropped, those numbers are not necessarily true for the sub-demographics. So because whites comprise the bulk of people in America and whites as a number dropped, the overall suicide rates dropped. However, if you look closely at the bottom of the screen there, Native Americans were up 5%, young black females were up 30%, young black males were up 23%, female Asians were up 30%, Hispanic youth males were up 20%, female youth Hispanics were up 40%. Those are not going to be reflected in the overall rate simply because they don't comprise a large enough number. but those are now the people who are most at risk. And if we go back to that study that was just published, we see that corroborated not just in the last couple of years, but from 1999 to 2020. So now we're talking 20 years worth of data that show that adolescents aged 10 to 19 have increased in their suicidal completion rate. That's totally unacceptable. Now, suicide is a big problem, and there's lots of things we can do to mitigate root cause, like Mike said in his introduction. But that's not what this video is for. This video is to train people on how to respond to firearms owners and people who live with firearms, because they comprise such a high percentage of the demographic across America. Now, when we're talking about, demographics across America, we have to be mindful of geography too. If you live in northern Nevada like I do, the firearm ownership rate is not 50%. It's probably more like 75 or 80%, which means 3 out of 4 people who come into your office, whether it's a dental office or primary care office or pediatrics or mental health like I operate, that proportion of or likelihood of somebody who owns a firearm is going to be that much higher. So we can't afford to be ignorant about how to talk to people. All right, let's go back to our suicidal youth for a minute. So do you know the basics of suicide or crisis intervention? And for those of you who are new, maybe this is brand new. For those of you who need a refresher, this might be good. For those of you who do this on a daily basis like I do, just bear along with me. I don't mean to talk over you or past you or beneath you. So we want to ask about a plan. Do they have a plan? And that indicates to us the level of severity and conviction that they have to, following through. If you don't have a plan, you're just like, sometimes I wish I just was dead. Okay, well, that's not necessarily a plan. We were asking for something like, I'm gonna go drive off the Golden Gate Bridge. All right, well, I'm considering that this is a youth in front of me. What do we know about this youth? Do they drive? Do they have a driver's license? Are they even of driving age? If not, the likelihood of carrying out that plan drops a little bit. The next thing we ask is about means. Do you have the means to carry this out? Meaning, do you have the car to go to the Golden Gate Bridge? Do you have a map? Do you know where to go? If they say, well, no, my family doesn't even have a car, or we just, take public transportation, it's like, all right, well, now we're a little less likely than we even were before about following through. And we got access to the means. So let's pretend they do have a car. Do you have access? I don't even know where my dad keeps the keys. I've never driven before. I wouldn't even know what to do. I couldn't even back out of the driveway. All right, now we're sliding down a little bit less, right? A little less likely. And then the last thing is we ask for desire. And parenthetically, we say scaled desire, but we scale all of these things if we're savvy about it. And desire is the commitment that's required to follow through with the plan, providing they have means and access to the means. So I like to scale in very extreme fashions. And the way that I do this is I make 0 impossible and I make 10 impossible. So on our scale of 0 to 10, 0 would effectively mean your life is perfect. You have no suicidal ideation whatsoever. You wouldn't change anything. Everything you ever wanted is presented right there in front of you, and your life is blissful. Nobody's going to pick that because there's always something we can improve, right? Then we have 10. And 10, I make it as extreme as possible. So I pretend this person's sitting in front of me, or they're on the phone and I can't see them. And I say, all right, 10 is you're so suicidal that if we end this conversation, you're just going to step out and the first thing you're going to do is walk into traffic. Or find some means to follow through. So I want to make it as extreme as possible. And then I ask them to pick a number. And it doesn't matter where they land on that scale. It gives me information about how committed they are to following through. From there, there's a whole variety of intervention strategies, again, that are not designed for this course. There's the state offices of suicide prevention. You can access these types of things through. You can take a safe talk training. You can take an assist training. But the point of this is that if you're dealing with somebody who's in a crisis, your job is not to fix the person and their life. Your job is to regulate them back to pre-crisis state. If their life was fouled up before the crisis happened, your job is not to unfoul their life. It's to return them to pre-crisis state. And then refer them to somebody else who can take it from there and help follow through with unfouling their life and fixing the root cause of why they even got to be in that place in the first place. So what are some common methods of suicide? We'll continue with our little slide deck here. So you see on your screen here the percentage of suicide deaths by method in the United States. On the left we have female, and on the right we have male. As you can see, firearms constitute the biggest percentage of all of them. Now, in females, it's a little more stratified. You see 30, 30, 30-ish, and then other is that 10% balance. But in males, it's 55.5 0.9%. That's almost, 60% we're talking are completed with a firearm. Then there is the pie chart, which breaks it out. So you can see, again, a little bit different representation of how the suicide attempts balance against the fatal attempts. So an attempt that doesn't work, that is not successful, in other words, and I know there's language police out there who say, don't call it a successful attempt because then it's a reward. A success is a reward. No, I'm not getting into that. I don't care to split hairs about vocabulary. I care to communicate a point. And the point is, if you attempt and fail, you lived. That's a good thing. And we know that about 90% of people who attempt and don't complete go on to die by other means, meaning they don't attempt suicide again and die that way. So it's really important that we keep people from taking their own lives, because if we do, they have this introspection, they have this insight, and they go, I don't want to do that ever again. That was too scary. It embarrassed me. I'm full of shame, whatever it is. And they go on to die later on by some other means. That's good. But we see that 71% are attempted overdoses. That's a really high number. But if you flip to the other side of actual completions, overdose is only 12%. The biggest one, firearms, it's about 54%. And we know this across time. This hasn't really changed much. The reason for that is firearms are more lethal. It takes one bullet. We don't know how many pills it takes and what kind of pills, and that all varies by body weight and sex and all sorts of things. So we want to focus in on firearms because they are the most lethal kind of suicide attempt. They're most likely to be completed. We would be remiss if we didn't pay attention to access, because that's one of our themes in this presentation. So how do states compare? Now, I am mindful that these data are old. It's really hard to find more accurate data because these surveys are very expensive and they're time consuming, and sometimes they don't capture enough people. But when we break out from 2000 to 2002, we got high gun states, quote unquote, and low gun states. You can see that the percentage of adults with a gun at home in a high gun state, about half, 47%, versus low gun states at 15%. The firearm suicide completion rate is much, much higher. It's basically double at that point. So you got total suicides on the left of the high gun states, 12,000 for males, 2,700 for females. And then in the low gun states, 6,400 and 1,600. If you look at firearms, it parallels. So you got 8,400 for males in the high gun states, 2,400 for low gun states, 1,200 for females, 176. So we know that access matters. Now, however, Walk the Talk America has a very strong position on saying that we believe that the way to intervention and suicide prevention and mental health care is not through restriction. Now, that doesn't mean that access is not important. Access is very important, but we want to put that in the hands of the owner to control their own access. We don't need government interventions. We don't need policies. What we need is the ability of the person to be educated and choose for themselves what path they're going to take in order to restrict their own access, not to just say you're not allowed to have guns in your home, or you're supposed to store your ammo separate from your gun, or any of those other debatable things. We want to say access matters in a time of crisis. So take that home with you. Remember that access matters in a time of crisis. And unfortunately, laws and policies aren't variable by times of crisis. They're there permanently in law or code. So we want to be mindful of that. Let's take a look at law enforcement suicide. So on the left-hand side, we have law enforcement suicides, and then on the right-hand side, we have line of duty deaths. This runs from 2016 through 2021, and we have fairly accurate data, but they do continue to shift over time because, as the asterisks indicate, they are self-reported. So a lot of this stuff comes from the Blue Help website. You go to bluehelp.org, you'll find out about law enforcement suicide versus line of duty deaths. See, in 2016, suicides, it was the last time that suicides were below line of duty deaths, and you see the numbers just increase after that. What's really interesting is that in 2020, you see that the line of duty deaths jumped again and outpaced suicides, but 145 of those 264 were from COVID. And then again in 2021, 169 of the 283 are from COVID. So we're still seeing more police taking their own lives than they are dying in the line of duty. And line of duty isn't just a gunfight. Those are very rare, actually. It's automobile crashes, it's heart attacks in the line of duty, and this is not good. We need to be tending to our professionals who are trying to protect us and enforce the law, because if we're burning them out to the point that they're taking their own lives, it leaves the rest of us unsafe. And we want to pay attention to that. And this is very close to me, and this is one of my own biases. Because I come from a family full of cops, I want to make sure that I'm paying attention to this. In another presentation, you'll see Brandon Casanelli, who is a law enforcement officer and a marriage and family therapist intern here in the city of Reno. That's in our part 2 presentation. You can see him talk a little bit more about some of these risk factors and what to do about it. You'll also see military personnel. Chris Jakomick in our part 2 presentation talks about military suicide. It's very, very captivating, and we'll spend a little time here talking about that. So you see some statistics in front of you. I'm not going to run through them because you're competent enough to read, but we see that 22 a day there. I want to highlight that. 22 a day is a term that's been tossed around. There's actually a website called 22aday.com, I believe, and that references the number of military veterans who take their own lives on a daily basis. Now, in actuality, since they've parsed the numbers out a little bit more closely and refined them, it's closer to 18. It's like 17 point something. But really, like, one is too many. And again, these are men and women who have gone and served and protect the country, protect our freedoms, and we want to honor them and provide them the resources and the wraparound services that they need to stay healthy once they discharge and they're trying to integrate back into regular life after they've experienced military life. If that many people a day are dying, what does that say about the culture that surrounds our military personnel? Now, we've had some very, very cool privileges to work with the Veterans Administration. Mike was part of the Prevents Task Force. He went to the White House and shared some information with them. And Walk Talk America is very proud to be working with these groups to help bring more awareness and more action to what we can do. And he alluded to some of that stuff before, like our screenings. And again, we'll talk more about that in a minute. But here's something alarming. And I don't mean alarming insofar as it's frightening, but it's something, again, we need to pay attention to. So since about March of 2020, we've had an estimated 12 million new gun owners. That's not new gun purchases. That's new gun-owning individuals. And these data come to us from NSSF, which is the National Shooting Sports Foundation, and they track this kind of stuff with some relative approximation because we don't actually know. We don't have a national database for a lot of reasons that we don't want. So we just give our best guess, and that's based on background checks and so forth. The questions that we have to ask ourselves are these people storing responsibly? Are they trained? Back in the pandemic, when everything was locked down and ammo prices were sky high and ranges were hard to access, we don't know that people were going out and purchasing things like locking devices, safes. We don't know that they're even buying holsters, right? Were they getting enough ammunition to go out and train regularly so that they can be safe and store responsibly? We don't have a magic wand. And what I mean by that is this issue is not going away. We have some, estimates range 300 to 400 million guns in the country, approximately 120 million gun owners. That's a lot of people, and it's not going away. We have to meet the issue where it is, not where it could be someday, not where other people have it in different countries, but right where it is now. And that is, we got a lot of guns, we got a lot of gun owners, and we want to be compassionate to what they're struggling with and not infringe on their ability to execute their hobbies and habits, their desires in life, their passions and their curiosities, and certainly not their rights. So that's something that we want to be mindful of too, is that this number continues to grow as people continue to get more and more curious about firearms ownership, and the growing demographics are women and minorities. And that's not news. It's easily accessible. You can look that up anywhere. That's not hidden. The growing demographics are women and minorities. So don't assume that the person sitting across from you in your counseling session, just because of the way they look or their gender identity, is not a gun owner. In fact, it's probably safer to assume that they are, given the statistics. So let's go back to our suicidal youth. Let's pretend that you're an outpatient counselor like I am, and you're sitting in your office, much like this one, maybe not with the sound panels on the wall. But you're sitting there and you're having a conversation. It's an angsty teenager who's 14 years old, just has heartbroken because he got dumped by his girlfriend. And you know this family, you've built great rapport with them. The parents don't happen to be in the session at the time because they dropped the kid off and went to the grocery store. And you know that they are into firearms. They hunt a lot. And what do? What's the next question out of your mouth? What's the next observation? Well, I'm glad you asked, because that's what this presentation is for. What we want to do is we want to ask things like, where are your guns stored? Do you have access to them? We don't want to ask, do you have guns? I already know that. I don't want to be nervous about it when I ask either. So I want to make the presumption, based on statistics, half of our people are going to have guns or be around them, or more, right? Depending on where you live. I want to make the presumption. I'm going to ask the question in such a way that says, where are your guns stored and how? What that indicates is that I am competent to have a conversation about storage. Now, earlier I mentioned something about storing responsibly. Are the new gun owners storing responsibly? What we're trying to do with Walk the Talk America and presentations like this is introduce new language. We want to get away from the safe language. Safe is mercurial, it's subjective, the definition varies from person to person, and frankly, it's gotten a little watered down over the course of the pandemic because it's like, stay home, stay safe, wear a mask, stay safe, get a shot, stay safe. What does safety even mean? I mean, how do we evaluate that? So we want to set that aside and stop saying safe. Frankly, most gun owners think they're the safest people on the planet because safety is preached so much throughout the gun community that if you ask, are you storing safely? They'll be like, yeah, of course I'm storing safely. Are you safe with your guns in the home? Yeah, of course I am. What you're not asking is, where are they stored and how? And what we're trying to do is redefine storage and responsible storage specifically as meaning preventing unauthorized access. I want to say that again, and there will be a graphic across the screen that says it too. Storing responsibly means preventing unauthorized access. Now, who's unauthorized to access? Well, that could be the person who breaks into your home while you're away and wants to steal your stuff. Are your guns locked up in a safe? That would be responsible storage. You're preventing the unauthorized person from accessing them. What about the angsty teenager? He may be authorized to take the 30-06 out hunting with you when you go shooting and you're looking at, killing mule deer or whatever. But is he authorized in that moment when he's depressed about his girlfriend dumping him? Probably not. Possibly that unauthorized person is you. You, the gun owner, may be not authorized if you're in a moment of crisis, and you shouldn't be around your guns either. Now, I don't think you need the government stepping in to take them from you at that time of crisis. Maybe you could just ask your wife to change the combination. Maybe you could hand them off to your neighbor. Maybe you can just do something that dismantles them for a time being. You say, here, take the bolt carrier group, right? We can get into more of those options later when Rob talks. But we want to ask, are you storing responsibly? Are you preventing unauthorized access? And if you have this 14-year-old sitting in front of you, the parents aren't there, and hopefully he's competent enough to answer this. But if he's not, also what you indicate with that question is he probably should be. And it lets him know that you care enough to ask and that you presume that he's responsible enough to take that action to keep himself, yes, safe. So we ask, where are your guns stored? How are they stored? Do you have access? And hopefully he's honest with you, because if you've been effective at building rapport over these many sessions, he'll say, well, they're in the safe. I don't actually have the combination. Dad does have one that's stored in his nightstand. It's not in a safe. He keeps it there because he's afraid that if ISIS kicks in the window at 3 a.m., he just needs to be prepared, right? Well, at that time, that may be safe to the gun owner, to the dad, but it's not responsible because his kid is in crisis. So we want to be having these conversations, and that's a great way to break the ice and assert yourself as competent in this language, in this culture, so that you don't push the kid away, shut him down, think that you're taking away his hobby of hunting mule deer or whatever it is, and you're not threatening the parents with legal action. Something else that we want to keep in mind as practitioners is we have a hierarchy of intervention strategies. And at the bottom of the interventions ladder is what we call the least intrusive intervention. Now, for me, least intrusive intervention in mental health is conversation. It's talk therapy. Some people say the least intrusive intervention is medication, and that's okay. We don't need to debate it. But if failing talk therapy, I want to go up to the next level of intervention, which might be more sessions per week. Maybe I get them into groups. Maybe it's intensive outpatient. Maybe failing that, we go into full hospitalization for a time. What's not on the ladder is taking your property. That's not appropriate for us. We're medical practitioners. We don't need to be in the business of seizing people's property or having them red flagged. And we got a whole thing about red flag laws later, so we don't have to go into that right now. But what we need to know is, as practitioners, let's not step out of bounds by leaping out of our own fear response to saying, let's seize the harmful object in your home to keep you safe. Let's level up to the next level of intervention. That would probably be pushing the pause button and saying, bring the parents in. Let's talk about storage, right? Let's get back to some more statistics. Earlier, Mike mentioned the alcohol industry. They don't just talk about drunk driving. They started the designated driver program voluntarily. That's where we want to get with the firearms industry. We're working on it. We're getting there. We're proud to say that we've made some really strong inroads, and a lot of people are aligned with what we're doing. But because about a third of American homes have a gun, which is that 120-ish million people out of the 330 million people in our nation, and approximately 50% of them live with one, it's not an off-limit topic. In fact, I would invite you to go willfully into it, volitionally. Like, be curious, be humble, but step firmly into the topic. Don't be afraid of it. There was a gun shop project that is still ongoing out of Colorado, and about a third of those gun shop owners who were contacted for the project had known somebody who died by an impulsive suicide purchase. And this is really important because it means that so many people are touched by this that it's not off limits. And there's a quote there from Kathy Barber that says, most gun groups have a culture around firearm safety, protecting the family. So if you extend that protection to suicide prevention, it's just a natural fit. You're like, hey, you want to keep your family safe? Let's keep them safe from taking their own life. And you'll find, in my experience, I've found this, but you'll find it too, that people will be nodding along with that sentiment. It's very, very cool. Mike also mentioned screenings and flyers. So on your screen is an image of the gun box flyer. That's the thing that actually goes into the firearms box. If you've never bought a brand new firearm before, what you do is you make the purchase, you take it home, it's in a box, right? And you open it up and there's some stuff in there. There's the federally mandated cable lock that secures it. There's the warranty information. There's the instruction manual. And in there, in many of these manufacturers now, in an increasing number, by the way, they're putting our flyer. It says mental health. It's okay to talk about it, right? And it's just something passively to suggest that guns and mental health go together. This flyer also goes into accessories and different products, not just firearms. And then the next image you'll see on your screen is the gun shop flyer. So we have two flyers. One goes in the products. One just sits passively on the counters at ranges and retail stores. And it says the same thing, mental health. It's okay to talk about it. As firearms owners, we have, sometimes it's hard to talk about this stuff, and, that's okay. And then on the flip side, there's white space for a local agency like Zephyr Wellness. You see Zephyr's logo on there, to stamp their logo, or if you ask for our PDF, we'll be happy to send it to you. You can pre-print it with your own logo, and then you walk around to these firearms shops and retail stores and ranges, and you say, hey, would you mind putting these flyers on your counter? It just sits there, it's not intrusive, and people can pick them up while they're waiting for their purchase to be conducted, their background check to come back, and they just look at it and go, oh, okay, this is cool. And because it's mental health with a locally trusted agency sitting in the firearms shop, they know that it's something that's not spooky, it's not of the occult, it's not to be afraid of. And they all invite you to go take a screening at the WTTA.org/love URL. And what's in the screenings? Well, millions have been completed by now through the Mental Health America website. You can see an example of some of them on the screen. Mike mentioned that a couple of them are in Spanish. That's the anxiety and the depression screens are in Spanish. And the results are, what you see on your screen. The race and ethnicity is close to census. There's chronic pain, lung problems, diabetes that contribute to this. But what's key here is that about 35% are the ages of 11 to 17. That's our youth, non-adult youth. And then 32% are 18 to 24. So if you put those two together, you see on the pie chart there, that's 2/3 of the screeners are young people. They love taking these things. And that's why the wristbands are so important. You can hand wristbands out at schools, and it has nothing to do with guns. It just says, hey, take a free anonymous mental health screening. And kids love that. It's a great way to check in on themselves, just like Mike's daughter did that one time. What do we get out of screening? Well, it promotes recovery. If you take screens, you're more attuned to your symptoms. You're checked in on yourself. You know what's going on. You're better able to communicate with your provider. You can recognize when you're improving. You can recognize when you're failing. And you're just overall more well-informed and better able to manage yourself. So I want to talk for a minute about how we acquired the content for this presentation, the whole idea of it. Now, it turns out we're not the originators of this concept. There's a guy named Gianni Pirelli who deserves a very significant shout out. And he wrote a book called The Behavioral Science of Firearms. Now, Pirelli is a psychologist. He's a clinical psychologist in the state of New Jersey. And what he talks about is the way he created this book. And you can listen to Pirelli's interview on our podcast. Again, Guns and Mental Health. Look up Gianni Pirelli, Gianni Pirelli, and listen to his story. It's very, very cool. But in a nutshell, he says, I'm a psychologist. I do these evaluations for people who are going through stuff. And I kept getting asked for a gun eval. Now, apparently in the state of New Jersey, you have to have a firearms evaluation if you want to go get a firearms license or a card to buy one. And he didn't know what they were talking about. So he started consulting some of his colleagues and looking for literature on it and couldn't find any. So he said, well, I guess I have to create some. So what he did is he created essentially what amounts to a 600-page literature review that encompasses, the history of firearms all the way up to present day and some of the complications and some of the takeaways from his book and his influence on our work is that we need to be able to be conversant in this stuff if we plan to engage in the firearms culture. Now, you may be saying, I don't plan to do that, but I've already taken that excuse away from you because I told you that half of your clients are going to be walking through your door either owning them or living with them, right? So firearms, the whole topic is absolutely on the table for everybody. And you run no risk at all by saying, where do you store your guns in a time of crisis? Because the person goes, I don't own guns. Great, we move on. But you run the risk of pushing them away if you fumble the conversation. So Pirelli says, if you want to be really good at this, you need to immerse yourself in some trainings. Now, at the time you wrote the book, there were no trainings. We created one just less than a year later. His book was published in 2019. 2019 was our first episode of this training. We did one in July. We did one in December. We had one planned for March in Las Vegas, and then the world shut down, which sucked. So we had to scrap that. But then we had a really cool opportunity to go online, and we took it virtually. And thanks to the CASAT program at the University of Nevada, Reno, they hosted it for us. And we ended up with like 230 people signed up for that training and who took it. And we did it again a few months later, and we had another like 75 people take it. So to date, we've had almost 400 people take this training, and that's really cool. And it's Pirelli's vision coming into existence. Now, to Pirelli's credit, he's created his own course. So we're not afraid of competition. We just want to make Earth better. We want people to heal, and we want people to be functionally competent and literate in this subject. So we absolutely endorse Dr. Pirelli's work. If you're more interested in finding out what this is, please look him up. His training will be launched, I believe, in early 2023, and I think it's going to be about 10 hours. Ours is 9-ish, give or take. So please look up his training if you want to know more about this, get really good at it, because you may be in a situation where somebody needs a psych eval in order to move forward, or otherwise what's known as a gun eval, to move forward and restore their rights if they've had them restricted from them. So if you're interested, the best way to get into more training is, Pirelli also suggests this, immerse yourself in the culture. Go to a range, go to a store, start asking questions, pick up some good literature. As you may or may not know, this is a reshoot of the original one that we did in December of 2020. And since then, we've met a lot of really cool people, and we've incorporated their work into our work as well. One of our favorites is Professor David Yamani from Wake Forest University. He teaches sociology, but he's also got a sociology of firearms course where he takes his students to the range and exposes them to the experience so they get hands-on interaction. Now, that happens to be part 3 of our course. So the next time we do an in-person part 3, you can get a range experience too. Now, there is travel involved if you don't live in the area where we're doing it, but that's a pretty cool experience if you've never shot a gun before and you've become gun curious, as Professor Yamani's website is called, Gun Curious. It's a great way to explore in a safe space with trusted people like us. I mean, I guess you trust us because you're listening to this. And you can actually have the experience of firing a gun for the first time and know what that's like. And it's very, very cool. He also has a series called Light Over Heat on YouTube that we highly recommend checking out. Again, gun curiosity is completely okay. A lot of people don't know about it because they just haven't been exposed to it, much like Mike in his own upbringing. Even though he was in the firearms industry, he has a story where he had never shot a gun before and was scared to death to do it. And that's a cute one you'll hear at some point in the future. So let's get back to what we're doing with this information. On your screen, you'll see a Venn diagram. And in that Venn diagram, it's an approximation. Unfortunately, we couldn't make the pixel small enough on the mass shootings dot to make it stand out. But it's truly so small that it's statistically insignificant. But what do you hear in the news all the time? Mass shootings, right? What was Mike's motivation for doing this? Mass shootings. Find the next mass shooter. Why? Well, it sensationalizes us, right? It pings our limbic system. It triggers our emotions to say, look out, this is scary, do something about it. But logic says that stats don't line up. So look at the screen there, and you'll see that from 2018 through 2020, and at the time, we still don't have verified 2021 data, so I didn't put that in this slide. Even though we're filming this in 2022, I don't like to use data that aren't verified. So you'll see firearms deaths, suicides, and then you'll see the percentages. And you'll see the overlap there. 0.3% of all firearm deaths, that's all firearm deaths, are from mass shootings. However, 58% of all firearm deaths are suicides. So if you want to move the needle on gun deaths or unintended outcomes or unfortunate consequences of firearms, we have to address suicide prevention. Broadly, we address mental wellness, because if you're mentally well, you're not going to take your own life. Now, we all know that suicide is impulsive sometimes, and sometimes we can't intervene. We understand that. But broadly, if you're doing well, things are going well, you're getting what you want out of life, you're not going to take your own life. If you look down below too, we hear a lot about the AR-15 bans and assault weapons bans and so forth. Well, mass shooting by rifle, you see 72 of the 112. That's 14% of the 0.3%, which is, it just never happens. You talk about firearm deaths by rifle, it's just not a thing. But that's what you hear about. And why? Because it sells clicks and it gets you to draw your attention to headlines. And that's how media make their money. I have a journalism undergrad. I know this stuff. So if we know why people are trotting out the mass shootings and the school shootings and mall shootings in front of us and using it to, advocate for rights restrictions, we can say, well, maybe that's not going to be the most beneficial use of resources if we're trying to truly to stem firearm deaths. What we need to do is pour more money into access to health care. And a lot of it comes through this cultural competence training, so that when we access mental health care, the mental health care professionals aren't fumbling and awkward and judgmental with their language when dealing with the gun owner. This slide is shocking, we like to put it in here because it's shocking. So the worst mass shooting in American history occurred in Las Vegas, Nevada, Mike's town, my home state. 59 people died. Now, you see below there, we have more than the worst mass shooting in America daily, because 67 people every day die by firearm suicide. We've got to do something about this problem. We put it up there to illustrate that mass shootings are not the problem. They are a problem, but the problem is this suicide by firearm. So what do? Well, we put space and time in the impulse moment between the person and the ability to carry out the act. Anything that delays the ability of a suicidal person to have access to that firearm can protect them against suicide. This doesn't mean that gun ownership has to be restricted, just access in the time of risk. So we created this campaign called Cause a Pause, which is very, very cool. And I'm going to pause here so you can watch the videos that we have that illustrate how putting something up next to your locking device can prevent you from following through. A lot of the pushback from the gun community says something along the lines of, well, it takes time to get into my safe. I don't want to have my gun locked up in case ISIS kicks in the window at 3 a.m. and I have to, grab my gun and go engage, right? Okay. However, I invite you, and our whole team invites you, to train as hard accessing your gun in a time of need as you do putting lead on target. Think about that for a second. How often do you go to the range? How often do you take time with your grip and your stance and your defensive shooting? Lots, probably. Now compare that to the time you actually practice accessing in a time of crisis if ISIS does kick in the window at 3 a.m. What if you're stuck in traffic and there's a road rage incident? Can you access your gun if it's not carried on you? If it's in a lockbox underneath your seat, for example? Do you practice that stuff? Should you? Yes. And the way you do it is you just set it up the same way you do any other training. Turn all the lights out, get in your bed, pretend you're asleep, have your spouse around the corner, make a loud noise, jump out of bed, try to fumble with your safe or your locking device, and get that thing open and get it prepared and ready for use. That's how you do it. You do that over and over and over. You train it with your family. Rob and Personal Defense Network have lots and lots of videos on this stuff. They conduct trainings all across the country all year round. There's plenty of ways to get used to accessing your gun in a time of crisis as you do putting lead on target in that time of crisis. We talk lots and lots about, tunnel vision and focus and breath control and gross motor skills and fine motor skills. All that stuff comes into play when you're trying to access it. So if you're trying to prevent access in a time of crisis and it's a mental health crisis, then you want to try to train as hard as you do to access in the time of crisis that's a firearms necessary crisis. So 2 different crises, 2 different access needs. Let's make sure we're training properly for both so we remove all excuses. I don't know that anybody needs guns stuffed under their couch cushions or randomly staged on top of their refrigerator, especially if you got children in the home. Let's all get on the same page together, store responsibly, prevent unauthorized access, and practice as hard as you do retrieving your gun as you do when you're deploying it. All right, so let's go back to our suicidal youth. Now let's say that you've taken this course, you're highly competent, you know exactly what to say. Do you know enough about guns to talk to him competently and conversantly about guns, at least until his parents get back? We want to distract them. It's a distraction technique. It's used widely in counseling to get the person out of their sort of psychological tunnel vision and help regain trust, diminish the intensity of the session. So you might start talking about, what he owns and what he shoots and how he shoots it and what his parents own and that kind of thing. What do you know? Well, fortunately, we have Rob Pincus, who is one of the best experts in the firearms community, who's taught internationally across many different formats and interfaces to teach you about gun culture and guns 101. So we're going to hand it off to Rob now, and he's going to do his thing.